Hello and welcome to the Child Neurology Foundation's 2021 Patient Advocacy Summit. We are happy that you are here with us. My name is Jessica Nickran and I support programs related to transitions of care at the Child Neurology Foundation. This panel is called How Can Telehealth Improve My Transition of Care? This is our inaugural Transition of Care Patient Advocacy Summit, and we believe that the patient voice and experience is an integral part of a successful transition from pediatric to adult care. This summit focuses on centering those voices and experiences, ensuring that these young adults and those who support them have the knowledge, tools, and confidence to be able to make the process successful. In addition to this summit, CNF offers other resources in the transitions of care space, including a toolkit for young adults, their caregivers, and their clinicians and healthcare providers to begin and encourage the many discussions required for a successful transfer to adult care. This toolkit is also available in Spanish. This and our other resources in transition of care are available at childneurologyfoundation.org/transitions. These resources and our summit would be impossible without our partners. We are able to put on summits like this for free thanks to the generous support from our partners in transitions of care, Acadia, Biogen, Eisai, Genentech, Greenwich, and Zogenix. We thank you. All right, let's get back to this panel. I'm thrilled to introduce you to our two excellent speakers. Dr. Mary Zupanz has been instrumental in the development of comprehensive pediatric epilepsy programs throughout the country, including at NYU, Columbia University, Mayo Clinic, and in her current position as the co-medical director of the Neuroscience Institute at the Children's Hospital of Orange County. An internationally recognized expert, Dr. Z has published many articles in peer-reviewed journals in epilepsy, infantile spasms, and transition of care. Elisa Ware is a project director with Family Voices. Elisa has spent the last decade working to improve access to education, medical services, and community supports for children with special healthcare needs and their families. She received her master's degree in social work from the Catholic University of America and is currently pursuing her PhD in social work with a research focus of autism diagnosis and treatment in the African American community. She is licensed by the Association of Social Work Boards and a licensed graduate social worker in Washington, D.C. and Maryland. Elisa is also the proud parent of a 16-year-old daughter with an autism spectrum disorder. Thank you to you both for being here. At this point, I'd like to hear a little bit about what you are doing at your institution. Dr. Z, could you tell us what transition of care looks like and how you've been able to incorporate telehealth?
Well, our transition of care is a work in progress, as it is for most pediatric neurologists working with adult neurologists. But we do have a structure in place due to the fact that Children's Hospital of Orange County, which is affiliated with the University of California, Irvine, we've made it one of our strategic initiatives. So there's actually some money that's being placed in addition to the words about transition, because oftentimes people will talk about transition and you won't see much action. And so we have hired we haven't hired a medical director yet, but we have two physician champions. I'm one of them in neurology, pediatric neurology, targeting the epilepsy population. And then one of my colleagues, Dr. Ken Grant, in gastroenterology. And then we have hired a nurse practitioner and a social worker, both of whom have experience in transition and developing tools to help healthcare providers understand what transition readiness means and how to successfully transition our adolescents, because we start early, becoming young adults, and hopefully transition them to adult care. There are certainly challenges in that, but right now we have been working with our youth beginning at age 12, introducing the concept of transition to parents, because they take a step backward, because as a child neurologist, I really feel like they become a part of my family. And we look at not just the medical diagnosis, but what's going on in the home and in the family. And we have resources such as a social worker, dietitian, pharmacologist to help. And the social worker is invaluable in just helping us wrap our heads around the many challenges that families of children with special needs have. And so we are working on the concept of transition. How do we transition these 12-year-olds, empower them and their families to become increasingly independent as they can be, knowing that in some of these youth, adolescents, and young adults, there may be limitations. We also, over time, introduced the concept of guardianship, which to many parents is completely foreign. Like I've had families where I've been working them for years, and I always introduce the possibility that their young adolescent becoming an adult may need some help from their parents, and that at age 18, at least in the state of California, they become independent adults unless the parent or the school system believes that there may be a need for guardianship. And we actually have to work with the court system to make sure that that paperwork is intact. And most of the time that is worked through, but it can be really challenging and expensive for many of our families. Luckily, CHOC does have a system in place where we have lawyers who work pro bono and work with our families to ensure that guardianship takes place in a orderly fashion and in a way that is understandable to not only the parents or the caregivers, but also to the youth and young adolescents. So those, and now we've worked on tools for our beloved electronic medical record. I'm saying that in jest, of course, to incorporate tools so that a physician or other healthcare provider can look at our transition readiness toolkit and understand where an adolescent may fall in the different domains of transition readiness and where the family stands. And every time that they're seen in different clinics, it's updated and can be subspecialty specific. So that's kind of the nitty gritty of it. Some of the challenges that we found, I think the biggest challenge for us is finding adult providers. And not only in the primary care network, but in adult neurology, and for me, adult epilepsy, who are willing to take some of our patients. Because what I've found, and I'll be interested, Elisa, in what you say, but that it's very siloed, and they leave this nurturing pediatric environment where we're taught to, I look at the entire family. I'm trying to incorporate the whole family into the picture, and I'll have, and you may appreciate this, is that they'll say, well, I'll take care of the epilepsy, but I don't want to deal with the autism. Well, it's the whole, this is a person here. We're talking about encompassing the whole medical home. So I found primary care providers, particularly family practitioners, who are very open and understand the concept of continuity of care and how they have to have a medical home. And whereas with adult neurologists and epilepsy specialists, they want to deal with their subspecialty, but it's not that they don't want to deal with it. I think they feel uncomfortable and not knowledgeable in different aspects of pediatric care that we feel very comfortable with. And I've learned that we don't have the resources there, or they don't have the resources. So for example, I'm working to be embedded in the adult epilepsy program at the University of California, Irvine, because I think I could learn a lot from them, and they can learn tons from me about how to successfully transition our adolescent and young adults to adult care and how to navigate that road. And it'll be a bilateral street. So that's the next step, the next trajectory that I'm going to take. In addition, when it's not possible, let's say they live in Bakersfield or Sacramento, where some of my patients come from, that's where telehealth is really, I think, a silver lining to the pandemic, is that if I transition a patient to my family, I consider it my family, this youth this child that now has become an adolescent and now is a young adult, when I transition or hopefully successfully transition them, I get the parent and the adolescent, young adult on the line with the adult provider, with myself, and oftentimes the NP and or social worker, and we have a meeting. And the family gets to introduce, or the patient gets to introduce themselves and what their concerns are, may give a synopsis of what their medical history is. And then we have a kind of an open discussion, open forum as to what the challenges may be, or are you familiar with the diagnosis? What information do you need? What the family and the patient's concern is, as well as the adult provider's concerns are, and we can have an open dialogue. And oftentimes, I can't do this forever, but I often provide my cell phone number to the providers themselves. And as this system grows, we hope to have a 1-800 number with various people on call that a provider can call and say, I'm having trouble with X, Y, or Z. Who should I talk to? And we can direct them to that person. So those are some of the aspects that we're working on in transition. It is not fully formed. There's a lot of work we need to do. There are challenges with insurance, God help me. There are challenges with providers, finding enough providers or providers who are willing to take patients or will be open, particularly some of my patients who are on medical assistance, that can be a challenge. And then who are open to maybe looking at the family, not just the patient in a specific diagnosis. Mm-hmm. So with that, I will open up the floor or open up to Elisa.
Thank you so much for sharing that, Dr. Z. It sounds like there's a lot of really interesting things going on at CHOC, and that, telehealth is in some ways really improving some of those communication challenges. So, Elisa, at this point, I'd love to hear how your work fits into this. What have you been doing professionally at Family Voices around telehealth, and what have you been working on around transition of care?
Sure. So if you don't mind, I'm going to share a couple of slides, and just to kind of share a bit about, okay. So first I'm going to start with a kind of a bit of a personal story and my own experience with transition. So this is my daughter, Lauren. She is now 18, actually almost 19 years old. And she has an autism spectrum disorder, as well as some other mental health challenges and diagnoses, as well as a fairly significant ADHD as well. So we've been navigating this throughout her life, from when you see the picture all the way on the right, where she's just a little one that we didn't even know any of this, to this is actually third grade, the picture in the middle where she was actually diagnosed. She did not receive her diagnosis till she was 8. And then this is her graduating from high school last year in the middle of the pandemic. And so our own story was a little bit, we had a great pediatrician, very family centered. We were in a wonderful medical home that really kind of wrapped around us. They understood our culture, they understood our needs, they understood, her needs, and all the complexities that she had as we navigated diagnoses and treatment and all of those things. And then her pediatrician actually left the practice. And he when she was 17 years old and almost on the cusp of 18. And we were like, what do we do? Do we move to a different pediatrician? Do we now shift to an adult provider? And because I'm in this work, right, I had always been doing small things to get her ready for transition and her beginning to take ownership over her health and her healthcare. And so here we are, she's about to turn 18. We're also at the point of, she right when she was turning 18 was also when the pandemic was kicking off. Plus now we need to figure out, how do we transition to an adult provider? And so as Dr. Z said, one of the challenges is finding adult providers that are willing to actually, take on clients that have a lot of complexity and needs and specialists and all of those things, because she comes to the table with GI specialists and mental health specialists and all, right? So we're trying to figure out, where do we go next? And now whatever we do is going to have to be through telehealth, right? Because we're in the midst of a pandemic. People aren't really seeing, patients and families. So I took it to actually having a conversation with my own primary care doctor, who did not have a history of really accepting or seeing patients that had developmental disabilities or autism or any of those things. And like I said, my daughter had quite a bit of complexity, but I had a comfort with her. And so I posed it in my own telehealth visit. How can we, shift and move to be able to have my daughter see you? Would you be willing? These are her diagnoses. This is who the specialists are that she's seeing, and we're going to have to do this by telehealth. And I know, like, you don't get all the things that you do on an initial visit and all of that stuff. And so my primary doctor was willing, and I think a lot of it had to do with the relationship that she had with me. And so through telehealth and telemedicine, because did I mention my daughter also was going to college at the time? So, so she's at a distance. We're looking for a new doctor. Here's an adult provider. She's leaving a pediatrician. We got all of this coming together, right? And so I really think that without telehealth, it really wouldn't have honestly been possible, right? And we were able to actually pull in her mental health provider, which is probably at this stage in her life plays the most critical role in her healthcare and her medication management and all of those things. And we were able to pull her mental health provider into the conversation with the new adult provider through telehealth to really say, how do we meet her needs in this new environment? I was able to be a part of it, which I definitely think, the physician was open to it because of our existing relationship. Also, my daughter is very good at advocating for it. I want my mom to still be here in the room. She knows how to advocate for that for herself. And so I think we've gotten to see all of the benefits that telehealth can bring to transition personally. But as you said, in my work with Family Voices, one of the challenges that we know is before we get to using telehealth for transition, we have to get youth really comfortable with what is telehealth and how can it be used and what are the benefits of it and kind of squelch down some of the myths that exist out there about it, right? In our work at Family Voices, we actually did a assessment out into the community. We heard from over 2,000 youth and families across the country. And their number one thing was confidentiality and, uncertainty about how do I actually see a provider? How do I access them, right? And so if they don't have that basic understanding, it's going to be hard to get to really utilizing telehealth, even for the transition piece. And so we had the opportunity to develop, actually, we didn't develop it. We had youth develop for youth, by youth, materials to really help explain what is telehealth and what are the myths? How do we, bust the myths, if you will, in order to help youth understand the benefits of telehealth. So we've developed a video as well as a social story that allow you to understand all of the facets of telehealth. There's also another video and a social story that also talks about, like, how do you manage your mental health within the pandemic and kind of the role that telehealth and telemedicine can and teletherapy can be helpful in addressing that as well. So in addition to that, and in partnership with Got Transition, Family Voices also had an opportunity to work to develop some materials that I think are what Dr. Z is really talking about, right? That what can be done and during a joint telehealth visit, where typically you actually would have, you have a pediatric provider, you have an adult provider, everybody's in separate locations, you have the individual, right? You can't bring all these people to the same location in the same place. And telehealth really allows everybody to come and have this kind of joint session and joint meeting, if at all possible. And so there's a whole toolkit with tip sheets for providers, with tip sheets for young adults. And so for this particular audience, I put a screenshot of the toolkit that's for young adults that really helps navigate who do you need to have there, what will be discussed, what are some questions that you can ask during the visit, right, as a young adult, because that's really important. How do you advocate for yourself and make sure that the youth, if at all possible, can understand what's happening? And also one of the pieces may be, who else needs to be there? It could be that a family member needs to be there, right? Especially when we talk about individuals with an intellectual disability or other challenges where they really need that support. What do you do, or what do you want to tell the new doctor? What do you want them to know about you, and what's important? We know and I've seen this with my own child. Her pediatrician saw her from the time she was 2 to 17. It's no way that we could fill up this space with, telling the adult provider, so let me fill you in. How much time do you have, right? Like, it's not going to happen. It's not going to happen. So what are those key things that you want your doctor to know, your new doctor, about you, and those little nuggets, and including, the bright spots. What do you enjoy? What sports and things like that. And those critical pieces, like my daughter's thing is, can you give me my shot at the beginning of the visit? Because if I know it's coming and I have to wait, I'm not going to hear anything you have to say, right? So those are one of the things for her that as soon as she walks in, am I going to get a shot? Can you give it to me now and then we can talk? So, little nuggets like that a new adult provider is going to need to know that often people take for granted because your pediatric provider has known that for years and years. And then what do you do after the visit, right? So those are all things that we're working to help families understand all of the benefits that really exist with telehealth, and how it can really help to kind of shift things. And what we found is a very overwhelming process for families and for youth in navigating this transition and kind of getting to the point where you're moving to an adult provider. So I'll stop sharing. And I'll turn it back to you, Jessica.
Thanks so much for that, Elisa. It sounds like there's some really fantastic things happening with Family Voices and GAT Transition. And so appreciate you sharing some of you and your daughter's story. And I think you've highlighted that, transition really isn't one size fits all. We have these tools at Child Neurology Foundation and GAT Transition and places like Family Voices. But really, there needs to be this communication piece to make sure that you figure out what does work for your family, so that you can then go to that adult physician and say, if we're going to do tests or shots, we got to get it out of the way or else I'm not going to be here. And I think that's really, really valuable. So I'd like to focus a little bit on that communication piece and figuring out how to have those conversations to make it work for you and your family. And so both you and Dr. Z have talked about telehealth so far, and Dr. Z, you alluded to this a little bit in your intro, what's happening at CHOC. But if you could both say a little bit about how you have found telehealth either beneficial or a challenge in having some of these conversations with your patients, Dr. Z, or with your daughter's clinicians, Elisa, during this really important time in her life.
Sure. I'm happy to start. For us, it's really interesting. So at the beginning of the pandemic and kind of really the kickoff of, telemedicine being like, this is what you got to do. My daughter actually, after about 2 or 3 visits, so she had met with the primary care doctor, she met with her, one of her mental health therapists, she had met with her psychiatrist, right? So now we're 3 visits in, we feel like we're pros, right? And so, but I noticed there's a difference with her. There's a like, she's not as communicative in the visits as she is when we go in person, which I'm actually surprised, because for me, it's like, well, it's less social demands, it's less, and so I went to ask her, like, are you okay with the telehealth? Like, what's happening? And she said, I don't know what to expect. I don't know how they're going to communicate with me. I don't know, this feels different. When I walk in the room, she's developed this concept of like, I know they're going to introduce themselves. I know they're going to speak. I know that this is going to happen. I'm going to say this. Like, she has this kind of routine in her mind, right? And all of that goes away. And I think that was something that was very illuminating for me, that it's not, one is not trading for the other. They're very different experience for both the family and for the youth on the family side of things. And so with that, it took, some different strategies around communication to really get her needs met. One of the big things that comes up is, as I said, Lauren's really good about advocating for, like, I want my mom in the room. Well, that looks a little different, and that conversation is different when you're talking about telemedicine, right? And when we're talking about young adults, who's in the room makes a difference. And so she now has to communicate that not only to the clinician that I want my mom here or I don't want her here, and she has to communicate it to me, where I could look at her body language. I could look at other things when we were in person. There's a number of, of pieces that, and also I could feel, and I would love to hear Dr. Z's thought about this, but I could feel attention from the provider of like, it almost felt natural in person for them to be like, okay, mom, can you step outside the room? Versus, how do you say that through telehealth, right? How do you, we're in the same house. Am I going to step out the room? Do I have another room to go to, right? You don't know what my housing, circumstances are. So I think, what I really want to highlight is that the communication is a little bit different with telehealth. And so I think there has to be a lot of intentionality in order to be really explicit about what needs to happen, what are the needs, and that it shouldn't be taken for granted that the conversation is going to look the same as it does in person.
I think that communication changes with telehealth visits. The things that I enjoy about telehealth visits is that I get to see my patient and the family in their home environment and how they interact. Like, typically some of the other kids join in the visits. You get to know a little bit about the family. And with my patients who fit on the autistic spectrum disorder, it's interesting because they're in their routine, and it's usually a calmer, gentler visit than when they have to break the routine, come into a doctor's office where everything is strange and different and uncomfortable for them. Whereas in their home, I can see them naturally and interact with their siblings as well as their parents. That part I found really, really beneficial. And I've gotten very good at doing a virtual neurologic exam. And the parents are usually pretty good cinematographers in manipulating all that. But the children and adolescents like it too, because it's fun and it's different. So I learn a lot about the families and the family structure when I'm with a telehealth visit. Now, there are many things that I can't do at a telehealth visit that sometimes are important. As a neurologist, I want to, if a child is having trouble ambulating or walking, I can't assess muscle tone or spasticity. Do they have a subluxation, a slippage of the hip? So there's certain limitations to the examination. And if it's important, then I may need to see them in person. But many of my patients with epilepsy, the history is everything. And so being able to obtain the history in a relaxed environment where they don't have to wrestle with LA traffic and parking, miss work, miss school. I find them in a more relaxed state, and I am able to ask questions about the seizure history. I get more from the youth and adolescents than I would normally in that kind of environment. So I really enjoy it. It's sometimes, and this is true, I come from Wisconsin, where 43% of the northern part of the state doesn't have broadband internet. That's, to me, a travesty. Everybody, and in the rural areas, in California, Minnesota, everywhere, it's very challenging then to have telehealth visits. And to me, and of course, then with the school year, that's even been more challenging. I've had some patients who still visit me from Wisconsin who, if they're going to participate in school during COVID, they had to go to McDonald's parking lot to get telehealth. That to me has laid out some disparities that really should not exist in this country. It shouldn't happen anywhere. But I mean, we need to make that. That's where the infrastructure of the bill would, to me, really promote more leveling the playing field. That being said, I have enjoyed my telehealth visits. There are some challenges. I really like being able to network and communicate with other providers and family members, because we have parents who are divorced, separated in different locations, and we just bring them all in and can have a conversation. That part I think is very, very enjoyable. And I see my job as really trying to engage the youth and helping them be as independent as they can. And sometimes the parents are very helpful. And then there are other parents, and I have many patients with intellectual disabilities who either underestimate or overestimate their use capabilities. And that, I think, is more of a challenge in a telehealth visit to, when you can't ask somebody, like you said, to step out of the room, like, where are they going to step out to the room?
Exactly.
To? Where are they going to go? But in general, I think there is a silver lining to telehealth. And I think I'm hoping Congress understands that and will maintain this avenue, because it really has been a godsend, especially to many of my families who have to travel long distances, have limited income, who have youth who have trachs, G-tubes, wheelchair dependent. It's a whole expedition to come to my clinic, whereas I can really conduct a nice telehealth visit and get most of the information I need by just communicating over Zoom.
There's just one other piece I want to add that just you talking, Dr. Z, kind of brought up for me, that I think there's a population that telehealth really is beneficial for. And again, I've had a chance to experience it myself and with my own daughter, is and in my former work, as I work primarily as a social worker in a medical center, and so when kids transition to college, which is another huge transition, there's often really a challenge with continuity of care, and we see that either they have to go long waits and wait for breaks in order to get medical treatment, or like medication maintenance. They're getting 90 days worth of prescriptions and trying to figure out how to get back home or find a clinician close to their university. And for us, my daughter's care did not change. All of her providers continued to maintain her care over the time that she was at living on campus at her university. And the big part to that is that it fostered greater independence. She got to be able to really develop. She scheduled her own appointments. She put them on her calendar. She worked with the providers to schedule times that worked for her. Her mental health providers, for example, she was able to say, I feel like I'm doing okay. Can we shift to every 2 weeks? And her taking ownership of her health in a way that often can be challenging when they're moving from, secondary education to post-secondary. And I think that's really important to highlight kind of the role that telehealth can play in maintaining that continuity of care as they move into different areas. The other part to that is, I was also, when she wanted me to be a part of a visit, I could be sent a link as well and be at home, and her university is 50 miles away from our house, and she could be where she is and I'm where I am, and we're both able to contribute. And there were times I was on the appointment for 5 minutes and she was like, okay, Mom, I'm good. You can hop off. I'd get off the appointment and they would continue on with the visit. So I think there's just a lot of it gives flexibility to both parent involvement as well as helping grow independence of youth as they're transitioning in other ways.
Yeah, no, I would echo that entirely, because
Mhm.
you are spot on about university students. And then for them to go to university healthcare centers, if they have, let's say, intractable epilepsy,
Mhm.
oh my goodness, they don't know half the drugs that I use, and they're
Mhm.
terrified of them. And so for me to just have a telehealth visit, I got a student who was at Purdue University, which is might as well be on the other side of the world, and another
Exactly.
one in Nairobi. And we are able to link up, which is wonderful. But for a university student, you are exactly right. You, you know, it enhances their independence and empowers them to take ownership
Absolutely.
for their healthcare. And it's then you don't have to transition at all. You can maintain the care with a single provider. And I think that's beautiful, because if there is a crisis, then he or she could, the patient could call me, I could hook up, and we could potentially all link together at University Health and say, let me tell you, let me share with you, or have you say these are my issues, this is what I'm having troubles with. And then the provider at University Healthcare, I can offer guidance as much as I need to, and really maintain the continuity of care. That's a
Yeah.
really, really good point.
Yeah.
Because what we don't want, and all too often happens, is that's where patients fall into that crevice that I showed you on my slides, is that they fall through the cracks. If when you're making this transition period, I've had some providers say, well, I'm not going to refill the prescription because they've been transitioned to adult care and I haven't seen them for a while. And the adult provider says, well, I haven't seen him yet, so I'm not going to refill these prescriptions. Well, what happens? They either end up in the emergency room because they've run out of medicine and they have breakthrough seizures, or worst case scenario, they have an accident, end up in the emergency and have to be hospitalized because they've had a prolonged seizure, or there's a breakdown in care. And studies have actually shown there's increased number of emergency room visits, hospitalizations, and of course, adolescents don't ever want to think that they have a problem. So if they go off to college, at least in my population, they'll say, well, I don't really need to take my epilepsy medicine.
Absolutely. Not just in epilepsy. Yes.
Because you start feeling better. Why do you need to take the medicine if you're feeling fine? Yeah. Yep.
Feeling fine. And those are important lessons. And you just hope that the lessons aren't so significant that there's significant injury or, God forbid, death as a result of it. But that, you only have to do it once and end up in the emergency room to know, maybe I don't want to be in the emergency room for a while. But those are definite pitfalls that happen with transition. So our hope at CHOC is, with having a more organized program that involves the patient, the caregiver, the school, the adult provider, that we can make it a more seamless, transparent system so they don't fall through those cracks. And it's a challenge. If you found, I'd be curious, if you found that finding adult provider, I know you alluded to the fact that you had a good relationship with your primary care doctor, thank goodness. But isn't it a challenge for many families and youth to find adult providers who are willing to take on their care?
Yeah. So prior to, my daughter was a peanut then. She was a little one. I was working actually with a pediatrician, and she had her own private practice. And I went in to actually work with her on improving diagnostic protocols for diagnosing and screening for autism. So in the process, that's what I'm there for, right? But she's like, so what are your thoughts? I have all of these patients who are 23, 24, 25, 26, you know. She said, and I basically keep them because I don't know where to send them. I don't know what to do. So part B of my job became reaching out to the adult providers in the community to start having conversations. And I think, Dr. Z, what you said is spot on. They really don't know what to do. It's not that they don't want to, it's
Right.
how do I? What does this look like? How does it work? And so, that is a huge challenge for families. They aren't even sure how, but then even if you get to the how, it's all of the knowledge and the information of how do I get this from here to here, right? How do I share what's critical and what's known and all of those things? And that can feel overwhelming. And so it's like, it's easier to stay here. So I think it's a complex situation, but the adult provider piece tends to be quite difficult because there's a lot, pediatricians, gosh, they're asked to do a whole lot of things that then you move to the adult provider world and they're like, I kind of do this one thing. And I don't know what's going to happen with all these other things, but I only handle this one thing. And that's where, we also have to help families understand what it looked like in the pediatric world. You may have to look at, 2 and 3 doctors in order to fill that role or to manage some of those pieces. And I think that that's really important as well. Yeah.
Yeah, no, it's more, I've used the word siloed. It's much more siloed.
Yeah,
and,
for sure.
And by my being embedded in an adult epilepsy center or adult neurology, I think there could be a lot of knowledge imparted both ways. What their I'll learn what their challenges are, and I've learned already significant ones. Like they don't have a social worker, they don't have a nurse practitioner, they don't have a psychologist. So their challenges, they have to have certain number of clinic visits, and you can't do a visit like this in 15 minutes. There's no way in God's green earth you could do that. It's got to be an hour-long visit. Yeah. One way that I think we can help is we take it from the Child Neurology Foundation, the medical summary piece, and I often have the parents complete as much as they can because they have the institutional memory and they know what's most important to them, as does the youth, so they can do it together. But I also liked what you said, Elisa, about you need the youth, your daughter, for example, should tell her story and impart not just her medical diagnosis, but who she is as a person.
Who she is, absolutely.
Who she is, because autism shouldn't define her. She's so much more than that. I mean, she's an accomplished woman, and what she enjoys and what her interests are, that's all part of taking care of her.
Absolutely.
I think you need both of those pieces to really make it a story and a history that's meaningful. And so those are the kinds of things that then help the adult provider feel a little more comfortable and say, okay, I can do this. And then medical knowledge is easily imparted. It's feeling comfortable with, like you said, they have a subspecialty. I'm going to deal with this, but I can't deal with all the other stuff. But helping feel comfortable with all the other stuff.
Absolutely. It's interesting you brought up the piece about being all of who you are. So one of the things about my daughters, so she's a music major in school and she plays flute. So they were like, oh, well, you're going to need to get your wisdom teeth out. That's really important, right? And because she has an autism diagnosis, there's a lot that has to happen to have dental surgery, and so the pediatrician has to be involved, or the adult provider, whoever has to be involved. Well, when we went to the dentist and we're all, conversing what needs to happen, we got to put her to sleep. What does this look like? And she had a nerve wrapped around one of the teeth that they have to take out, which if they cut it could potentially numb her jaw for the rest of her life. So she's a flute player, right? So you can't play flute professionally and you have a numb jaw. Right. So this is where understanding the entirety of the individual then helps to lend itself to how do you care for it. So like they did a special procedure where they took half the tooth so that they didn't cut into the nerve, so she wouldn't have the risk of nerve damage, and all the medications that had to happen from the primary care doctor and all of that were, all coordinated. And it's it does take that whole of understanding, because I mean, if that wasn't a piece of the information that they knew, it could have been something that impacted her over the long term, which of course is going to impact her health, her well-being, her mental health, all of those things, if she can't seek the career that that she's trying to seek. So I think it's so important to look beyond just the medical condition and
Oh, yes.
and what they need to really get to understand. And I love what you said about the benefits of telehealth, that you get to see them more in that natural environment where you're able to learn some of those things and glean what's important to them. What do they value? Who's around them? What does that support look like, for sure?
Yes. No, I absolutely agree. It's telehealth has been a whole new world. We were stonewalled for years. We've been asking for telehealth as physicians and providers, and the insurance company said, no, not possible, not possible. We won't reimburse. And suddenly, within a week after COVID hit, voila, it happened. And you go, that's odd. That's strange. And our own ISD department, information systems, my nemesis, but just said, it's not possible. We can't possibly put all this equipment together. Within 2 weeks, all of our visits were telehealth visits. So this is where a tragedy, a condition like the COVID pandemic, there are some silver linings to it. It's a small sliver for all the trauma that all of us have lived through in the past year. But I think we've all learned from this, and I'm hoping it will continue, because it's important. I love having all of these visits together. You get people together where it would have been impossible to get them in the same room at the same time, especially subspecialists. Oh my goodness, that's but.
So that seems like an excellent place to end, especially with like the time. It seems like kind of put a cap back on it. Before I do our outro, is there anything that you, either of you, would like to say that we haven't had the opportunity to?
I don't think so.
No, I'll send you my slides if you want to.
Yeah, we can post that up. So
I didn't think of doing that because I got so carried away with the transition piece, but I did love your slides about what to, hopefully they could go to Got Transition and use that handbook, because that's invaluable, because families and youth, they don't know what to ask, and giving them a guide like that, I think, is so invaluable.
Powerful. We'll definitely be sure to post it up. And I also really loved the nope, this was made for youth, so that's by youth. It was just all really fantastic. So I thank you both so much. Dr. Z, if you send me those slides, I will make sure we'll put those slides up during your intro portion so that people can see it. So then when you refer to it later, folks can remember, and we'll post those resources. So thank you both so much. I really appreciated getting to work with you, and thanks for your flexibility with scheduling, and have a great night and weekend.
Oh my
Thank
goodness.
you.
So difficult. Oh, thank you. It's a pleasure meeting you.
Pleasure to meet you too. Yeah.
It's really, I'm going to check in on the Got Transition. I'm going to share this with a lot of families. I didn't know it was available. So, my bad. But now I've learned. So I have another tool to help share with my young adolescents. But I do have 55 patients who are 22 and over, and I don't know where to place them. That's why I'm asking them, let me come over. I'll help you out.
Yeah, for sure. Right.
Yep. All right. Well, thank you both.
Thank you as well. Have a great evening.
Okay.
Bye-bye.
Bye.
Bye. And that will conclude our panel today. Thank you so much to our panelists, Elisa and Dr. Z. On behalf of CNF and our communities, we are so grateful that you have shared with us your time and expertise, and we look forward to implementing what we have learned in our own communities. As a reminder, CNF and our partners have more resources in transition of care available both at childneurologyfoundation.org/transitions and also on the Password Protected Hub where you access the Zoom link for this talk. We'd like to again thank our partners, Acadia, Biogen, Eisai, Genentech, Greenwich, and Zogenix. And we invite you to help fund our programming if you're able, because the greatest feedback you could give is a donation. So please go to childneurologyfoundation.org/donate-online if you are able. Thanks again for joining us, and be sure to check out the rest of the talks available on the Summit website.